Yeah, that's right, Lauren, Steve. And this is a concern that's top of mind for so many parents. And we've seen it rear its head in stories that we've covered recently. Last week, we reported on those court documents tied to that attempted case of human trafficking out of Harnett County, which included some very hard to read details about the victim in that case's struggles with mental health issues. And tonight, we heard the first steps of what state leaders are calling an action plan that they hope will spur real action around this topic.
It touches every corner of the state. It touches every school, so it's top of mind across the board.
Dr. Sangvai was recently sworn in as North Carolina's top health official. But before that, he was a physician in Durham for 2 decades, where he observed firsthand the rise in mental health concerns in kids.
I think after the pandemic, we certainly saw a rise across the board. So as I look over the last 20 years of being a family physician, it's been particularly profound in the last 5 to maybe 7 years.
Sangvai was one of the state leaders present at the launch of what health officials call Changing Minds on Monday night, an effort to bring lawmakers, law enforcement, doctors, and educators to the table together to support adolescent mental health.
We don't need to study the problem anymore. We know the problem. Now it's about driving towards action.
According to nonprofit Cara Nova, the host of Monday's event, North Carolina ranks 44th nationally in access to behavioral health resources. For state leaders, that's proof a new approach needs to be taken.
It's not going to be solved by healthcare. It's not going to be solved by government. It really requires all of us coming together, finding creative solutions, working collaboratively, looking for consensus.
Last week, Eyewitness News reported on a disturbing incident where adolescent mental health issues played a major role. Court documents obtained by Eyewitness News show a 15-year-old girl was messaging with a man on Instagram who was later charged with kidnapping her in an alleged sex trafficking operation. The mother of the victim told authorities she had been diagnosed with depression, has been involuntarily committed in the past, and has had suicidal ideations in the past.
What I always tell parents is that is your job as a parent, is to check in with your children when you're concerned about them. And just because they're getting older doesn't mean they don't still need you to help them stay safe.
Adam Miller is a psychologist who helps run the UNC School of Medicine's Child and Adolescent Mood and Anxiety Disorders program. We asked him about that case and how parents should respond to concerns they may have with their kids' behavior.
We now talk about mental health more, and we have better tools to identify kids that are struggling. And so I think that that's a part of why we've seen things increase over the past several decades.
There is optimism that progress is being made on this topic here in North Carolina. Secretary Sangvai pointed to the $835 million that's been invested in behavioral health resources since October of 2023. But leaders in every sector present at that event earlier acknowledged that there is a lot of work to do, and it is really just starting anew. Live in Raleigh, Sean Coffey, ABC 11. Eyewitness News.
Yeah, interesting to hear people say, Sean, we know the problem at this point. Now it's sort of time to fix it. Sean Coffey, thank you. And there are resources available for people who need access to mental health assistance. The Hope for NC helpline is available to anyone in North Carolina, and it will connect you with a mental health support system and resilience support. That number is 1-855-567-3463. The 988 Suicide and Crisis Lifeline is also available 24/7 for anyone experiencing distress. You can find these resources at abc11.com.